This is not a substitute for actual EMDR therapy, but it's a start. They're saying PTSD is a form of brain damage, not a moral failing. I'm an operating room nurse, and I had PTSD before the pandemic. This is how I'm healing. EMDR, and I'm going to show you how I do it. Bilateral activation tricks the brain into recategorizing memories from scary to safe. Right, left, right, left, right, left. Kind of like we're running away from a lion. The lion is a traumatic memory stuck in my brain, and I can fix my brain without even having to talk about the trauma. Number 1, I think of the worst image of the memory, rate my distress level 0 to 10. 2, notice any sensations in my body, tight throat, energy in my feet, pit in my stomach. Number 3, what negative core belief describes this memory? AKA, what mean words am I saying to myself? I'm not enough. I'm powerless. My emotions aren't valid. I should have done something. I am not in control. I have to be perfect. It's not okay to show my emotions. I cannot let it out. 4, take a deep breath and start tapping. About as fast as this. Slower if I start to feel more distressed. Faster if I'm not distressed at all. I do this for about 90 seconds, trying not overly hard to keep those 3 things in my mind. Worst image, body sensations, negative core belief. Keep breathing. When it's been about the length of half a song, I stop tapping, open my eyes, take 3 deep breaths. It's okay if I'm crying. It's okay if I'm not crying. I take a few minutes to reflect on how that was emotionally, on how my body feels. Now I let my mind arrive back at the memory and repeat the process over again, holding those 3 things in my mind. I've done this for as little as 5 minutes and as long as 2 hours, but I saw the best results when I did 90 minutes with my therapist once a week and 20 minutes every other day on my own. Now that time is not including the very important calming exercise, 5 or so minutes of using my imagination to put these emotions down for now, metaphorically available for the next time I choose to do EMDR. Close my eyes and imagine all the body sensations I felt earlier, the emotional energy. Pull them outside my body as if they're wisps of smoke or a gas or something that can easily be contained in an imaginary object. What colors are they? Pull them outside my body, squish them all together in a little ball, and put them inside a container of my choosing. A jar with a tight lid, a suitcase, and I stow it somewhere safe. I imagine mine sitting on the bookshelf in my therapist's office, ready for whenever I choose to revisit this memory. Now I start tapping slowly and gently and imagine myself on a beach and really try to hear the waves, feel the sand between my toes, smell the salt air, feel the sun on my skin, a breeze in my hair. Deep breathing in this beautiful beach space. What color is the water? Are there other people enjoying the beach too? What time of day is it? Have I been to this beach before in my mind? That salt air still smells really good. Keep breathing. And slowly, I'm going to bring myself back to the present moment. What sounds do I hear in the room? How does the chair feel beneath me? I open my eyes and I can go about my day. There are several variations on this. Eye movements, buzzers, so do some research, find a type of EMDR that works for you. Try this every day for a half hour and don't skip the calming exercise. I had EMDR sessions for 90 minutes every week for 16 months. I felt better after the first month. I felt fantastic after 16 months. My trauma was related to the death of my dad, the patient deaths I've been witness to as a nurse, a childhood burn, and violence at work. This is not a substitute for you getting a therapist, a legitimate mental health care provider who is experienced in EMDR. Your mileage may vary, but I made this video because we work in a field that is existentially, emotionally risky, and we have to start somewhere. So share this tool for free with healthcare workers or anyone who's seen fucked up shit in their life. Take this small amount of knowledge and use it to build on, to heal. I'm scared that we're going to have a wave of PTSD in healthcare, and there won't be an adequate reserve of therapists or a delivery system that works. So this is also a call for more therapists. If you're looking for a career or a way to help in the aftershocks of this pandemic, consider becoming a therapist. Please. Nurses will need you. But first, heal yourself. And know that it goes smoother and faster with help.